Chapter 11, Lecture 2, Pricing Behavior of the Private Health Insurance Industry. In the previous lecture, you learned about the market structure of the private health insurance industry. In this lecture, you will learn about the pricing behavior of the private health insurance industry. In economics, we usually use different models to explain the market behavior, or basically a specific firm's types of firms' behavior. Here is the first model in this chapter. Basically, the dominant insurer pricing model indicates that some health insurers have become quite dominant over time, and others have remained fairly small in terms of market share. So basically, the dominant firm is price maker, and the other firms with the smaller market share, they have to be price taker. And this is basically based on the rule of three, which says that in a competitive market, there is only room for three major players, and other firms, they have to be they have a smaller market power, and they have to be price taker. Now, the organization become dominant because of different reasons. So could be because of the pure luck, or because of the technical and pecuniary economies, and or because of the superior performance, and or maybe because of the mergers with other organizations. So we don't basically cover this pure luck, because that has different basically discipline, talking about the probability and risk and etc. So let's explain about the other factor, or define the other factor basically. Technical economies refers to any economies of scale or scope that may be conferred to a larger organizations, and you had this in previous lecture, that the economies of scale refers to the time when, by increasing the level of production, you decrease the average total cost. So in insurance policy means that by increasing the number of the people you are selling insurance, you're decreasing, basically your cost is decreasing, and you actually the premium price also decrease as well. Now, the pecuniary economies occur when large organizations purchase input and supplies at a lower price, and this actually is very clear, even happens to you when you purchase a large basically purchase. Usually you get a discount for the larger purchase than a smaller purchase. Horizontal integration is when firms producing similar product merge together, and that may benefit the consumers, or maybe actually non-competitive. And we talked about that by graphically by showing the Williamson model in chapter 9. Vertical integration also could be pro-competitive or anti-competitive for the impact on consumers. So these are the factors. Maybe the dominant, insurer have become dominant because of these factors. Now, in any economic model, usually we set the assumptions, and then based on those assumptions, we set the formula either graphically or mathematically, and then make a decision, make a conclusion out of it. And here are the assumptions for the dominant insurer pricing model when a competitive range of sellers also exists. What does it mean? It means that there is only one dominant firm in the industry, means that they have the biggest market share, and assume that in this example is Acme insurance company. And then there also so it's basically most of the time this dominant firm assumed to be low-cost producers. So easily, because they can actually produce the policy in the lower cost, so they can actually dominate the market. because they can actually set the price. So, I will show you how they can set the price and dominate the market. There are other in this model. We are assuming there are other, number of the firms. They have a small market share. So we call these fixed number of the firms. They're producing the same actually policies, insurance policies. We call them the competitive fringe. So each firm can be treated as being a price taker because they don't have any market power. They have a very small market share. So therefore, they have to basically follow whatever the dominant firm is setting the price. The dominant firm assumed to know industry demand, and so and then how much the competitive fringe firms will collectively supply at various prices. So remember that in economics, the full information is very important, and whoever has the full information has the market power, better market power. So if this dominant firm has, for some reason, has this full information, what is the industry demand, how many basically a policy can be sold in a specific area, a specific geographic area, a specific period of time per year, for example, in a state of Maryland, for example. And so that's one actually piece of information. It's very important. You have to know what is the market demand, and the other piece of information is how much the other smaller firm, the competitive fringe firm, can collectively produce or supply at various prices. So they have to know how much they have basically power in the market by the price, right? The firm's power is based on their market share and how much they can produce at each level of the prices. So the dominant firm can produce in the lower cost than the competitive fringe. So that's why they dominate the market besides the full information. Now, all firms produce a homogeneous product, means that they basically sell the same similar insurance policies. They're very identical. Now, again, in more detail, assume that Acme is the dominant health insurance, maximizes profit first by determining its residual demand. What is the residual demand? Means that the Acme knows what is the market demand total and how much the other firms they can produce, supply, and then they actually determine what is the demand for their policy. The residual demand is the amount of the health insurance left over for Acme in the market. So after deducting the amount of health insurance offered for sale by the competitive fringe insurers. So let's look at the marginal revenue curve, because this dominant firm objective is maximizing profit. We have to look at the marginal revenue curve, which usually in the monopoly is derived from its demand curve. So they have the same interception, but the marginal revenue runs below the demand curve. The marginal cost curve is below the fringe supply. What does it mean? Means that Acme can produce at a lower cost than the fringe supply. So they have the lower cost curve, and also they have a horizontal cost curve. So they have a constant marginal cost, means that compared to the other fringe competitive firm, that they have an increasing supply curve. By each additional supply, their cost increase. This dominant firm, Acme, has this advantage of having constant marginal cost. Besides this, the cost is below the fringe cost. Remember that the price basically in health insurance is measured by the premium rate, and we explained that why how you can drive the premium rate from the price from the basically cost and lead expenses later. So graphically, so we have a Acme Insurance, a dominance firm in the market, and we are trying to show the pricing model for health insurance. In the vertical axis, we have dollar per unit of policy, per unit of health insurance policy, and in the horizontal axis, we have the quantity or number of the insurance policies. So the red line is the demand, market demand, and the red, the red downward sloping basically line is the market demand, and this red upward sloping line is the supply curve for the fringe, competitive fringe firms, means that how much the other small firms can produce without the basically dominant firm. So the demand is market demand curve for health insurance, and the supply of the fringe market is supply of the competitive fringe firms. So the dominant firms is the in the market drives its before that, the intersection of this demand and supply provides the basically the quantity the fringe markets, fringe firms can produce without the dominant market. So it's a smaller amount, right, with the price of A. So their price is higher than the dominant firms. So their price is at the point A. Now, so the dominant firms in the market drives its residual demand by subtracting the fringe supply from the demand, market demand at each and every price. So at price A, the Acme residual demand is 0. So at this price, this is the intersection of the other small firms' supply and demand. So at this price, Acme is not producing anything. So because basically the other firms, they can produce at that price. Remember, the advantage of the dominant firms is that they can produce at a lower price to make the other smaller firm to exit from the market because of the, they can't produce at that lower price. Now, at the price A, Acme residual demand is 0 and offers no insurance on the market. At the price B, Acme residual demand curve is a market demand, and basically at this point, none of the other firms can produce at this level because the price is so low for them, they can cover their costs. Remember that if the supply is this, the lowest they can actually produce, at this point they actually have 0 profit, so they don't produce, right? So therefore, at this point, at point A, B, the Acme can take all the market demand. Now, if we wanted to basically find the Acme residual demand, so we can actually say that the actual Acme's residual demand is found by the kink demand labeled as ACME. So is A, as it starts any point below the A, because of course Acme can produce at this point, but it doesn't want it to produce at this point because then, basically other firms are producing at that point too. So he's gonna lose the market share. So, but any point from the A, the Acme can produce, and then AMCE. So the reason we put MCE because this curve is kinked. It's not a straight line. So, and any point above the marginal cost, Acme can produce. Any point above the marginal cost, Acme can have profit. So therefore, So therefore, basically, Acme can produce any point, this area, any point above the marginal cost and below the A, and then, of course, the demand curve is kinked. So the reason Acme is not producing on this demand, because basically it's not logical, because no other firm can produce above that, and Acme wanted to basically have the greatest market share. So Acme's marginal revenue is derived. So I tried to show the Acme's demand and marginal revenue by purple. Acme's marginal revenue is derived from its demand curve. So it's derived from the intersection here, and then it's running below the demand curve, marginal revenue. And Acme's marginal cost is lower than, is first of all, is straightforward, is not a upward sloping like the other supply for the other firms, and it's below the supply for the other firms, small fringe firms. So Acme's marginal cost is constant, and is lower cost producers, lower cost than the other producers in the market. So let's see how Acme maximize the profit. To maximize the profits, where marginal revenue is equal to marginal cost. Remember that the market power firms always set the quantity where the marginal revenue is equal to marginal cost. So marginal revenue is this point, and the intersection of marginal revenue and marginal cost is this point. So Acme's quantity would be this point, and then usually what happens, they go up and intersect with the demand curve. What is the demand? So Acme's demand curve is this point. It's not actually intersecting the market demand, because it doesn't want it to produce at the market demand. They look at the residual market to maximize their profit. So, and then they go here. The Acme's market price is at that point, and the quantity at this point. And then what happened? For the rest of the firm in the market, they actually cover the rest of that from total Q. So basically, total quantity is at this point. So the differences between the market demand and the Acme's market is the differences of the quantity that the other firms provide policy in the market. So to maximize profit, where the marginal demand is equal to the marginal revenue is equal to the marginal cost, Acme sells Q Acme, a number of the health insurance, and charges price of the Acme. So the fringe firms takes the price set by the Acme and produce the rest of the market output. Means that the differences between the demand for Acme's and the market demand, which is actually here, gives us the amount of the quantity of number of the policies the rest of the firms they can produce. So there are three applications here. First, the price of the Acme is at this point is lower than the A, the price of the other firms they can actually be able to produce, right? Acme can set the price lower than the market price for the rest of the firms. So because they wanted to have the higher market share. If they set the price at this point, so they have a smaller market share. So they wanted to still dominate the market by market share, basically getting more market share. So the price of the Acme is smaller than the price for the other firms, but Acme set the price of the Acme, and also if the Acme set the price equal to the E, Acme even can decrease the price even lower up to the point of the equal to the marginal cost. So the Acme, by setting the price at this point, can take all the market share and make the other firms to get out of the market, right? Acme can, by setting the price at this point, although the profit would be zero, but if they wanted to make the other firms to get out of the market, so easily they can actually get all the market share for a while. They can survive until all the other firms they get out of the market, and then they can take the whole market share. So the price of the Acme is less than the price the other firms they can actually afford, basically. But if Acme set the price equal to E, then the competitive fringe is driven from the market. The second application says that a larger competitive fringe makes the supply for the fringe firms shift to the right. Remember, when we have a bigger number of the firms or the new firms are coming to the market, there is a rightward shift to the supply, right? So if there is a profit in the market, the new firms are coming to the market, and we have a rightward shift of the supply curve, so that will decrease the price and increase the quantity for the coming the new firms to the market, means that the a smaller firm take the bigger share of the market share, and basically the second one, it says that a larger competitive fringe makes the supply shift to the right, and then Acme residual demand shift to the left. So basically Acme's residual demand decrease, and Acme's market share decrease, and then the market price decrease by shifting the supply to the right, and the quantity basically increase. So as we have a bigger number of the firms coming to the market, we become closer to the perfectly competitive market with the lower prices and higher quantity. The third application says that a more elastic, or elastic means that flatter, fringe supply shifts the Acme residual demand downward. So a more elastic or flatter fringe supply curve is actually what happened is taking more market share because they have the elasticity, and so it decreases basically the price and increase the quantity, and makes the market closer to the perfectly competitive market. So we talked about all these implications at the bottom of this graph. That's the same thing. So let's see, do health insurers possess monopoly or market power? So let's see what else we can actually tell about this market power. The impact of the actual competition as measured by the number of the firms, or HHI, or measure of economic profitability of the price. So remember, we can either look at the structure of the firm, or then we can actually also look at the economic profitability of the price and see if any market is enjoying of a high market profit, so there is a market power there. So taking evidence from various studies, let's look at the empirical studies. It appears that health insurers there is a market power when it comes to pricing their product, and so profit basically declines by 12 to 30% if one new HMOs enter to the market. So what happened? By a new firms entering to market, the supply of the fringe supply firms shifts to the right, and that decreases the price, and then and also the market share with 10%. If basically any new firms come to the market, the profit declines with the basically entering a new market to the market. as we saw graphically. And entry and expansion forced the HMOs to actively compete in the longer term because remember that in the market, sometimes the firms they have maybe profit in the short run, and then they lose basically in another time, but they have to survive. In the long run, you can actually determine basically whether they can survive or not in the longer term. So a greater number of the HMOs is associated with the lower premium, means that lower prices. So when we have a bigger basically supply of the fringe firms supply, we have a smaller prices. Remember about the rightward shift of the supply curve by entering the new firms to the market. So that decrease the price and increase the basically quantity. A greater health insurance market concentration reduce the percentage of the people covered. It means that if we have a market power, so we have a smaller quantity and we have basically higher prices. Let's look at the managed care organization, which includes the HMOs and PPOs mainly. The HMOs and PPOs, they're trying to integrate the delivery of the healthcare with the insurance function. They're managing basically the activity between the providers and consumers or buyers. The managed care organization moderate the scope of moral hazards, so they're trying to decrease the possibility of wasting and overutilization because of the moral hazard. We will talk about that in the next lecture. Various financial incentives and management strategies, they're trying to decrease these moral hazards. So the managed care organization, they're trying to come up with different management strategies to decrease the moral hazard. So one of these strategies is setting up the premium. The premium usually calculated based on the expected benefit to be paid out to the customer, to the policy holder. We call that expected benefit. And this expected benefit, remember that sometimes could be equal to the benefit, sometimes barely could be equal to the benefit, sometimes it's over what we get from the benefit, and sometimes actually lower. So that is usually calculated based on the average of the total member population in the insurance. So the marketing, so the premium is based on the expected benefit for the average customers, and the marketing administration expenses, we call admin, and federal, state, and local taxes, and the profit. So when we wanted to calculate the premium is based on the expected benefit plus the admin cost plus the tax plus profit. Now, if the price would be basically calculated based on basically all these here divided by benefit. Now, so if the expected benefit is equal to the benefit for the average total member population, so this equal to this would be 1 plus then we have this remaining divided by benefit. So one more thing that we have to add here is the expected benefit to be paid out is basically barely is equal to the benefit when we are calculating the expected benefit and cost. There is a forecast error always, we can call that E. So we have to always include that so the differences between expected benefit and benefit is the forecast error here. So the price of the insurance, which basically we call that loading fee, is the ratio of the premium to actual benefit paid out The premium divided by benefit so is basically equal to the price, which is equal to the expected benefit over the benefit is 1 if they're plus the admin tax and profit plus E over the benefit. So the example would be a price of the $1.50 means that the representative individual pays $1.50 to receive $1 in benefit. What happened to the rest of that $0.50 goes to the admin tax profit, right? So you always get just a percentage of the total you're paying for the insurance to get the security and peace of mind. Price of the health insurance reveals average amount that must be spent in premium to receive $1 in benefit, and the magnitude of the loading fee depends on these parameters that we use in the formula to calculate the premium. The health insurers compete on basis of the price, ability to control healthcare costs, and also remember that there is a trade of managed care contains the loading fee and the benefit paid. So between for calculating the premium, so for more spending on administrative function leads to a higher loading fee. So as in the formula, remember any parameters, increasing any parameters increase the loading fee or the premium. Let's talk about the other side of the market. So when we are talking about the market power, we could have actually market power from the other sides, from the buyer sides. So then let's see, do health insurers possess monopsony power? So what does it mean? First of all, if we have monopsony, means that only one buyer. If we have few oligopsony, means that a few dominant buyers of a product, and monopsony means that only one buyer of a good or service exists in the market, right? So basically, one buyer enjoys the market power of buying power. So when you are the seller and you only have one buyer, so therefore the other side, the buyer enjoys of the market power. So this may actually reduce the medical costs by forcing the healthcare provider reimbursement rates below the competitive level. So if basically the insurance company act as a monopsony to buy the providers' services, providers such as hospitals and physician services. So if the insurance company enjoys a monopsony buying the hospitals and physician services, so and if they set the price lower than basically real market price, so that may actually reduce the medical costs basically artificially, not naturally, by forcing the healthcare provider reimbursement rate below the competitive level. So yes, if they actually set the price below the competitive level, and the hospitals and physicians, they don't have any other insurers to buy their service, so they sell their product, their services, because they don't have any choices. But what happened? The lower reimbursement rate may discourage the providers from offering services on the market, and the reduction of these medical services may seriously compromise the quantity and quality of care received by the people in that area. So both price and quantity of the product are lower than if they are lower than the competitive model. In the case of monopsony, is expected to be lower than the competitive market, which is not good. Remember that competitive market, the equilibrium price and quantity in the competitive market is the most efficient price and quantity that the net gain is the maximum for the society. Now, graphically, showing the monopsony model of the market for hospital services. So we have the price per unit of policy, and then we have number of the patients, have the policy. So here, if the scenario one say that competitive market, we have a competitive market, and the point C is the intersection of the supply and demand, market demand and market supply, determines the price of the equilibrium P1 and equilibrium quantity Q1. So in that case, every basically a small firm is price taker. Nobody has the market share power. So then each health insurer has a horizontal individual supply curve. Each hospital faces a horizontal demand curve. So basically, there is no market power, and everybody here is a price taker. Now, the scenario 2 is one health insurer and large number of the hospitals are basically in point B at point B is the point, the price is the P0 and the Q0 at point B. So only one monopolistic insurer faces the positively sloped supply curve for purchasing each additional inpatient day. So if in this case, if we have a monopsonist insurer here, so monopsonists actually set the supply curve here. So in here, we don't have the marginal revenue. We haven't shown the marginal revenue, which is the basically at the intersection of the demand and below the demand curve. So usually the intersection of marginal demand and marginal supply determines the quantity here. And in scenario 2, one health insurer and a large number of the hospitals, basically, if we have this dominant firm, monopsony model, they actually produce at point Q0 and P0. So it's basically only one monopsonist insurer faces the positively slope supply curve. And so basically it is upward sloping because the cost is increasing by each additional inpatient day. Here, notice that when the buyer has the monopsony power, both price and quantity are lower than when we don't have the monopsony. So in the perfectly competitive market, we have a P1 and Q1, and in monopsony, we have P0 and Q0. So therefore, we actually lose this dead weight loss of ABC, which nobody actually get that. It is lost. No producer, no consumers get it, and we have a dead weight loss, which basically shows the inefficiency in the market. So, do the health insurers possess monopsony power? One health insurer cover all the people, right? When we have a monopsony, and basically represent the only purchases of the hospital services in the area. So each hospital can be treated as price taker. So if there is only one insurance in one specific area, say that one city or one state, then that insurance company is acting as a monopsony, buying the hospital services. So each hospital in that area should act as a price taker. And the market supply curve is positively sloped because there is a higher cost for hospital when supplying additional inpatient days. So because basically the prices are lower, they have to actually by each additional production or service, their actually costs increase. So monopsonists must pay a higher price. So the marginal factor cost here is above the marginal cost, the marginal factor cost above the market supply, and this reflects the additional cost of both marginal and inframarginal previous days, basically. So the maximum profit is determined based on the both quantity and price. The demand is equal to the marginal factor cost, and the price is on the supply curve. And as you notice graphically, the price and quantity are lower than the perfectly competitive market. So the monopsony theory suggests that a single buyer pay a lower price and purchase a lower quantity than the competitive level, and that creates a deadweight loss, which results from the monopsonistic distortion in the society, basically in the market, from the inefficient allocation of resources. So when the society is not, the markets are not working in a perfectly competitive market, the price and quantity are different than the equilibrium price on market. So we always have a deadweight loss, and depends on how these price and quantity are different than the perfectly competitive market, that deadweight loss is determined. So the empirical study shows that the typical HMOs does not possess monopsony power, and so the HMOs and PPO, there is no evidence of monopsony, so the finding that the price declines is not enough basically to show there is a monopsony power. Now, the health insurers likely possess the monopsony busting power in hospital services. Basically, because these hospital services, so where they possess a necessary market size, and hospitals are large size and few in number, the hospitals themselves, they have a market power. So maybe the health insurers, they cannot really act as a monopsony for the hospitals, but they can easily be, in contrast, health insurers may sometimes wield monopsony power for physicians, because physician services, they don't have a power to in the market because of their services typically is not concentrated. So what happened basically, that create the deadweight loss. If the previous studies, they conclude that there is no monopsony, maybe they actually looked at both of these together, so that should be differentiated, and basically look at the market for hospital and physicians separately.